everyone. Welcome to the second of the Aurora Health Alliance, Mile High Health Alliance eConsult webinar series. Today we're going to be focusing on the Colorado perspective. My name is Mandy Ashley. I'm the Executive Director of the Aurora Health Alliance. With me and co-running the show is Vicente Cardona with the Mile High Health Alliance. Just wanted to let you know that we will be following a tight timeline. Speakers, you'll be receiving a warning via chat from Vicente when you have 1 minute remaining, and we'll hold questions for at the end of each speaker. We'll have a little bit of time for questions before we move on to the next speaker. Of course, this is a Zoom meeting, so please be mindful of using your mute function. And then speakers, I'll advance the slides, so when you need a slide advance, just let me know. We'll be hearing today from Christopher Felenz from Kaiser Permanente, Matt Thompson from the School of Medicine, Beth Newhoffen from Denver Health, and then we'll also be hearing a patient perspective from Lori Gaynor and Katie Broren. So first up is Mr. Felenz, Dr. Felenz, excuse me.
Good morning.
Good morning.
Nice to see some familiar names and faces here. So my name is Chris Felenz. I'm a family doc at Kaiser, and I'm our Director of Safety Net Programs there. And I'm just going to give you a quick overview of our program, which we call the Specialty Care, Safety Net Specialty Care eConsult program. This is a program that's been around for 6 years. I'll have you move on to the next slide. And it was originally started in response to conversations that we had with our safety net partners, and actually my own personal experience having come from the FQ world and having worked there for about a decade before joining Kaiser. And that was that we were hearing a lot about the need for specialty care access for uninsured patients as well as Medicaid patients. And we thought, well, what can Kaiser do, or what can we offer? The low-hanging fruit was that, as a multi-specialty group, we knew, well, we had specialists, but how can we kind of affordably provide some sort of access for providers in the community to have their questions answered about patients that had specialty needs. And Kaiser had been using eConsults for, it was probably about 6 years or so prior to us starting this program, and really had great experiences with it internally. And we still continue to use eConsults and really rely on them to streamline access to advice from our specialists, to offload our specialists, and really kind of raise the bar as far as scope of practice for our primary care providers. And so we thought, let's try this in the community. Another factor that went into it was a statewide needs assessment that we performed back in, I believe it was 2010. But this was looking at all the FQs and community health centers in the state and asking them really what they needed from a specialty perspective. And there were quite a few specialties they needed access to that would lend themselves easily to eConsult model. So we began the program in 2014. We initially did not have these 8 community health centers as partners. I think we only had 3 at the beginning. That was Clinica, Salud, and it was MCPN at the time, now Stride. But since then, we've broadened participation in the community, and we now have 8 community health centers from the state that are participating with us, and those are listed there. Probably the FQ that uses it the most is Clinica Family Health Services, and I think the factors there are probably a little bit of geography and being a little more distant from the university and not having as strong specialty relationships with specialists in the community because of kind of where they're located in North Denver and Boulder County. The specialties that we began with were dermatology, because we thought that would lend itself well. Gastroenterology and ophtho were added a little later. Rheumatology was one of the initial specialties, and then pulmonology and endo. So the others, neurology and allergy, were added later as well. Over the years, so this is in total over the last 6 years, we've done 3,500, a little over 3,500 eConsults, and about 860 face-to-face visits. Now that was a program or a portion of the program that we started about 9 months after inception of the eConsult program, and it was in response to our specialists saying, hey, some of these consults we're receiving really need to be seen face-to-face, and we need to address these issues. So we went back to our operations folks, really kind of examined how we could budget this out as far as a community benefit program, and created some face-to-face opportunities for patients in certain specialties. Mainly this was in gastroenterology, where they obviously need to do endoscopies to diagnose and or treat things. And then in ophthalmology, primarily we were looking at providing cataract surgeries. I didn't put the average amount of visits for each year on there, but they run, generally it's about 500 to 700 eConsults a year, and then somewhere between 100 to 200 face-to-face visits. And that's kind of waxed and waned over the years as well. The most popular specialties were dermatology, endocrine, and cardiology as far as medical specialties. And when I say medical, meaning basically these are non-procedural specialties, although we have brought some patients in for echocardiograms or further cardiology testing. The gastroenterology and ophtho were the top as far as our procedural specialties or surgical specialties, just because that's mostly what they do day to day. Our turnaround as far as consults ranges anywhere between 1 to about 4 days, kind of depends on the specialty. And it also just depends on if our program administrator is in the office. She usually is, but if she's on vacation, sometimes she's not there to remind the specialist that, hey, there's a consult to look at. The reason she has to remind them is that we use an outside vendor as our platform for the eConsults. It's called Net Chemistry. They were very good to us over the years as far as providing use of the platform for a very nominal fee, because they knew we were doing this as a community benefit project. But the method of reminding the specialists remains, or kind of that onus falls on our program administrator, who checks daily to see if there's consults, and then calls up the specialists on call or emails them or chats with them to say, hey, please look at the consult. It's just that. Next slide, please. So we did do a program evaluation several years into the program. It was pretty limited. It looked mostly at the reception and experiences of the patients, the physicians, primary care physicians, and the specialists who participated in it. We were unable to look at outcomes. That was kind of our aspirational aim, but we didn't have the budget or the manpower to do that kind of evaluation. The results of the evaluation basically said that the program delivered timely responses, which were valuable on the primary care side of things. That this prevented oftentimes a need for an in-person specialty exam, which was very well appreciated from the patient standpoint and from a cost standpoint, because these were uninsured patients. We had several anecdotes, more than a handful of people who really said this was life-changing for them as far as the service that was provided and the help as far as diagnosing and treating their condition. Providers loved the collegiality that resulted, and there's been some great and kind of lasting relationships that have been created between our specialists and some of the primary care docs in the community in the FQs as a result. And really one of the best things was it allowed our specialists to donate their time to do something to give back to the community in a way that was convenient, because this is all asynchronous. I'll have you move on to the last slide. So I did want to just throw out my experiences using eConsults myself internally at Kaiser, and this is outside of our safety net program, but just as a primary care doc here. Really big win as far as reducing the need for an in-person specialty evaluation. Lots of times we can prevent the patient from having to go in and see a specialist and pay a copay or take time out of their day. And we can just address their need through primary care. We have very quick turnaround time. It's usually less than 24 hours in our program, but that's because everything's self-contained within Health Connect. it really does allow all of us in primary care to work at a higher scope, which is very satisfying. And over time, actually, your scope just kind of creeps up because you start to learn from your experiences and your eConsult responses what you need to do for certain conditions. And it really was, we found, integral to the team-based approach that we use and the integrated approach that we use at Kaiser. And it was very cost effective and in fact, allowed us several years back to kind of add to our primary care FTE because we were saving money by not using as much specialty FTE. So rather than growing those departments, we grew primary care. I think that concludes kind of my quick presentation of our program. I'm certainly happy to answer any questions.
Thank you so much. I have a question myself, and you could have covered it, and I could have been doing tech things in the background. But is this still an ongoing program?
It is. And we haven't seen our volumes affected that much by COVID. Infectious disease wasn't an area that we provided. And so we haven't seen much of a blip as far as up or down. We did have to stop some of the face-to-face consults that resulted from gastroenterology or optho eConsults just temporarily, but we're starting those back up now. That's
great. Thank you. Vicente or Joe, have any questions come in through the chat?
Yes. So one question for Chris is there a significant workflow disruption for the community health clinics providers using the eConsult platform?
I would say initially, yes. And we actually really processed that a lot. We would meet with the team leads for the eConsult partnership with all the safety net clinics on a quarterly basis initially, and now we do it on a kind of biannual basis. But there were clinics that really struggled with working this into their day because it is kind of arduous. The provider, the primary care provider, needs to formulate a question and then attach some data, whatever data may be salient to the consult, and then put it into a separate platform out of their native EHR into net chemistry. The clinics that performed the best were the ones that offloaded that task from the provider to a case manager. Clinica Family Health excelled at that and actually helped us kind of teach all the other safety net adopters later on how to streamline that process and make it something that the provider didn't really need to do, but someone else could do.
Yes, and another question came in. Oh, Joe, another question came in? I'll let you go.
Yeah, thanks. No, there's a couple questions. How do you handle eConsults for the 8 partners who are all on different EHRs? And I'm assuming EHR means electronic health record systems.
The reason we're able to do it is because we use one single third-party platform, and it's called Net Chemistry. It's a separate platform outside of their EHR that the provider will have to cut and paste their question into. It's also separate from our EHR, from Health Connect. So it adds an extra step for both providers on both sides, the specialist and the primary care doc.
Thank you.
Joe, do you have any other questions that came in?
Let's see. I think we have one more that I saw. Do you currently do behavioral health eConsults?
We don't, and I really wish we did, because that really is, I think it's one of the areas you can knock out of the park with eConsults. Internally, we do it at Kaiser, but for the safety net community-based program, we do not.
Thank you.
And then another question came in saying, since Kaiser works in multiple states, are other states having the same results in using eConsults as you guys are?
In the community, I'll answer in both ways, both community and internally. Internally, all the Kaiser regions have been using eConsults for over a decade now. And yes, we very much have shared experience, all positive in terms of that. As far as having a community eConsult program that allows safety net providers, we're the only state that's doing it. I worked for 2 years on a program to try and make that a national thing, and we got so close to signing a contract and making that span all of the states that we're in. in the end, it did not happen thanks to budget cuts and lots of other factors. So.
Thank you. I think that's all the questions I have received.
Great.
Okay, thank you so much, Chris.
Yeah, thanks for the opportunity.
Next up, we have Matt Thompson.
Hey, Mandy, can you just give me a thumbs up if you can hear me okay?
It could be a little bit louder. I don't know if it's my volume or my volume.
Is that better?
Yeah.
Okay, great. And thanks, Chris, for setting the foundation for today's discussion. My name is Matt Thompson, and I've led the eConsult program at the University of Colorado School of Medicine for the last 3 years. Our program is in partnership with CU Medicine and both UC Health and Children's Hospital Colorado. So we do have the ability to accept eConsults both on the adult and pediatric hospitals on campus. Next slide, please. So I'm not sure how many folks were on last week's session, so I'm just gonna share a couple slides high level about what eConsults are, kind of piggyback off of what Chris mentioned. If you think about the last decade, referrals to specialty care have more than doubled, and 1/3 of patients are referred to specialists every year. So how do we increase access to specialty care for patients across all payer types? Well, we found that eConsults are an effective way to address referrals without requiring a patient physically be seen in office. It can be done electronically through eConsults. Next slide, please. Oops, one back, there you go. The graphic here on the right-hand side of the graphic basically shows you what an eConsult is at a high level. If you're a primary care doc and you're seeing a patient in clinic, you're gonna have a clear clinical question for a specialist that you don't think that patient actually physically needs to be seen by a specialist. But if you as the PCP only had a little bit more information or help on how to manage the clinical question you have, you could treat that patient in your primary care clinic. So you can send off an eConsult, and as Chris mentioned, that's where you're gonna go on the EHR, you're gonna have a specific clinical question, and you're gonna include what's called decision support, or information that the specialist would need to answer a clinical question around a particular condition to a specific specialty. So if you're talking about a rash, for example, as the PCP, you're gonna write a clear clinical question, you're gonna indicate how long the rash has been there for, the size of the rash, and you're gonna take a picture of that rash, and you're gonna route that over to the dermatologist who's gonna receive that eConsult within their Epic in-basket or their EHR in-basket. For us, we utilize Epic. That specialist is gonna review that eConsult, and they're gonna either do one of 3 things. They're gonna respond to that eConsult with a clear recommendation on how to treat the condition in question. They're gonna decline it if it comes across as insufficient information, meaning that the PCP didn't follow the template or perhaps write a clear clinical question, or they're gonna convert it. And a converted eConsult is when the specialist says, this is a good eConsult, but this patient really should be seen in clinic. I'd recommend a referral be placed, and the PCP can place that referral. Next slide, please. So as you think about managing access to specialty care electronically, there's obviously a lot of stakeholders to, a lot of stakeholder benefit. For the specialists, they're getting more complex cases because you're actually driving away the lower acuity type cases and handling those via eConsult. So they're seeing more complex patients in their clinic. PCPs obviously have increased access to specialty input, continuity of care, and clear roles in co-managing the patient. Patients obviously have better access. It's convenient. They don't have to request time off work. They don't have to utilize gas. They don't have to pay a copay at this point in time for an eConsult, whereas they do for that in-person visit. And there's also benefit to leadership within hospital or different organizations, as well as significant value to payers because you're decreasing unnecessary referrals and you're really treating the patient in the primary care home. So you're treating them in the right place and at the right time. Next slide, please. So knowing this issue with access to specialty care and trying to brainstorm how we can improve that at the university, we obviously partnered with the AAMC the Association of American Medical Colleges, to utilize what's called their CORE program, which is a coordinating optimal referral experiences. And one of the components of that CORE program is eConsults. So we actually launched our program in 2018 with 8 adult health and 7 child health specialties. In 2019, and that was supported by funding through an interagency agreement with HCPF. In 2019, we actually expanded our program to include external PCPs, where we expanded it to hospital-owned primary care providers, both on the adult health side and on the pediatric side. They're called Peds Connect pediatricians. Those are our community-based pediatricians that license Children's Instance of Epic. So we expanded to folks who license UC Health's and Children's Instance of Epic. And then in 2020, through a SIM grant, which I'll talk about a little bit more, we actually created an interoperability between different EHRs using a third-party platform that Chris mentioned. His was called Net Chemistry Platform. We utilized a company called Arista MD. So this year we've expanded the use of eConsults to 2 FQHCs in the community. And we've also added 6 adult health and 5 child health specialties. Next slide, please. So what that all means as of the end of July is there's about 400 primary care providers in Colorado and 250 primary care providers in Colorado that have the ability to send eConsults to University of Colorado specialists. There's 27 adult health specialties live and 21 child health specialties. And the second table there just kind of shows you the value of the eConsults as we've been talking about. 81% of our eConsults are answered within 2 business days. So if you looked at endocrinology, for example, the average time to appointment at Anschutz on the adult health side is 44 days. These patients are being treated within 2 business days. So that primary care doc within 2 business days has a clear recommendation on how to manage that particular condition that they're eConsulting about. Next slide, please. So a little bit about our volume and where we're at today. This is adult health data only. We've had about 6,500 eConsults placed, 74% completion rate, 17% conversion rate. So those 17%, the primary recommendation from the specialist is that the patient should be seen in clinic. And about a 9% conversion rate. We've had about, of the 6,500 eConsults, about 4,500 unique patients across 36 different counties in Colorado. And when you look at what % of our patients are treated via an eConsult, when you look at all types of visit types, it's around 8.5% of our patients are treated with an eConsult. Now, I know not everyone has a car and not everyone gets around from a vehicle, but if you look at a patient's zip code and the time it would, or the mileage it would take to go from their zip code to Anschutz Medical Campus and back for an in-person visit, and you put a cost savings to that due to eConsults or due to the patient being managed via an eConsult, we've saved our patients roughly $75,000 in gas alone. And then Chris talked about the consistent use throughout COVID. Obviously, in-person visits dropped drastically across the entire state during COVID. Our eConsult numbers were consistent, about 400 a month across the specialties combined during the hard months of COVID, March, April, and May. So while in-person visits dropped off, we did see a consistent use of eConsults during COVID, driving up that % specialty contact, or that percentage of patients that are managed via an eConsult. Next slide, please. So I mentioned 2 FQs in the community that we partnered with. Very excited that Stride Community Health Center is on board with sending eConsults. They license UC Health's instance of Epic. In July, they sent 26 eConsults. 14 PCPs did that to 11 different departments in the university, 11 different specialties. 18 of those 26 eConsults were answered. The majority were answered in less than 24 hours. 7 of those had a primary recommendation that the patient needed to be seen in clinic, and 1 of those was declined because it lacked sufficient information. next month, in a few weeks, we're going to go live with Salud Family Health Center, and they are going to, since they're on a different instance or different EHR completely, they're going to have a single sign-on within their EHR through a third-party platform called Arista MD, where their PCPs can send eConsults to our specialists in-house. And as Chris mentioned, the PCP, in our example, the PCP can send the eConsult, or they can utilize what's called referral coordinators to do that. So there's two different options there. They will go live in September, so we're expanding the use of eConsults to 2 different FQs. Next slide, please. So when we look at patient outcomes, when you look at indirect cost and what it means in terms of cost savings for patients, our math and our data shows that we've across all payers, about $60 per eConsult direct cost savings to the patient, and about $40 per eConsult indirect cost savings to patients. Sorry, the $60 per eConsult direct savings to payers, $40 indirect cost savings to patients. We've enhanced referral efficiency because now patients are being managed with having more documentation provided to the specialist up front, so they can better manage that first initial visit on those eConsults that are converted to enhanced referrals. From a quality perspective, if you look at all of our 6,500 plus eConsults, 2.5% of those that are answered had an in-person visit within 30 days. So that's a really good quality number. We're happy with that. It's lower than the industry average of what's been published. And 0% of our eConsults resulted in an ED visit within 30 days. Just to kind of tell you where we're at now in terms of evaluating our data further, we're looking at no-show rate improvements. Have eConsults helped with no-show rates? Have they helped with improvement in referral completion? And have they helped improve access? I think I'm out of time, so I'm not going to go through the next couple slides. I believe this presentation will be shared. But if you can just move forward, I just want to share one last slide here. One more, please. So there's opportunity for statewide rollout here, regardless of what system you're using. eConsults are a way to improve access for our patients in the state of Colorado. And this is an important option for value-based payment models. There are funding mechanisms. Medicare does reimburse for eConsults. In Colorado, to my knowledge, there are no payers that reimburse for eConsults. So our team is in constant communication with HCPF as well as commercial payers to share the benefit and illustrate the value of eConsults in hopes that those are going to be reimbursable services. I'll open it up for questions. Sorry, I felt like I had to rush through that a little bit, but I know we're on a time limit.
Thank you so much, Matt, and you and Chris, and I'm sure Beth coming up after this. It's amazing to hear what eConsults have done to improve access to specialists, especially for the folks that health alliances are focused on, the vulnerable and the underserved. So it's a story worth telling, and we want to continue to highlight the great work that you all are doing. Vicente and Joe, questions?
Yeah, I got a few questions. As far as the population that uses eConsults more between pediatrics and adults, and for what specialty, do you have that info?
Sorry, can you say that question again? I wasn't understanding the question.
Yeah, between pediatrics and adults, which population utilizes eConsults more, and for what specialty?
Oh yeah, significantly. The adult health population significantly utilizes it more. It's about 6,500 versus 1,000 over the same time period. And the highest utilizers of eConsults on the adult health side are dermatology, clinical pharmacy, endocrinology, and cardiology and neurology. Those are kind of our top 5.
Gotcha, thank you. And then another question came in. Do you track the increase in access to specialty care from Medicaid patients through the eConsult system?
Yes, we do have the breakdown of payer type. That's part of the analysis I mentioned that we're trying to do now. So we don't have the data summarized yet, but it is an analysis that we're working on.
Thank you.
All right, a question that came in. Is there any advocacy happening to increase or maintaining reimbursement for eConsult?
There's a lot of advocacy across the state for that, yeah. So a lot of different stakeholders are presenting on such as presentations like this, just to make the make folks aware of what eConsults are and the value they bring to the multiple stakeholders that are involved in that. So a lot of work going on to highlight this across Colorado, and a lot of report outs back to health plans across the state to make sure they understand that information as well.
Awesome. And then another question that I have here is, are the specialists that respond to eConsults all within the university system, or do you have recruited specialists outside the system to participate?
Yeah, everything's done internal. So we have 2 to 3 specialists that are faculty members that answer eConsults per each specialty.
Awesome. I know there's a lot of questions that were being asked today, but please bear with us. We're on a time crunch, and I will send those questions to Matt, and hopefully we can get you a response as soon as possible. So it's not that we're trying to limit your voices, but we're trying to make sure everyone gets a little bit of talking time. So thank you guys for responding in the chat.
Yeah, Mandy, if I could just summarize, eConsults are available for all payer types. So it doesn't matter if you're uninsured, covered from a commercial plan on Medicare or Medicaid, it's available for everyone.
Thank you so much. Sometimes they happen without the patient even knowing personal experience, which is wonderful. Perfect. Next up is Beth. There we go.
Hi, everyone. I'm Beth Walton from Denver Health. We can go to the next slide. Put my picture in here since I'm not on video. Anyway, I'm Associate Director of Quality and Operations at Denver Health, and I'm also faculty for American College of Physicians, which is why I gave the national talk last week, and I'm back this week. But next time, I'm not talking, so that's either good or bad for you. Next slide. So Denver Health, I'm sure most of you know Denver Health, you're in Colorado, but I always like to say, you know, what we do. We've been around since, it was a city hospital since 1860 to serve, you know, healthcare needs of the rapidly growing city and continuing growing city of Denver. We're the Colorado's primary safety net institution, serving the needs of the special populations, especially the poor, the uninsured, pregnant teens, persons addicted to alcohol and substance use, victims of violence, homeless. Denver Health, I don't know if you knew this, provides care to 33% of all Denver's population, and 1 in 3 Denver area children each year, and nearly 930,000 total patients visit annually. That was last year's data, and 151 unique patients every year data too as well. Next slide. And this is, I just want to give you an overview of, this is our type of payer mix. And the biggest emphasis on this is mainly our biggest payer mix is the Medicaid. So Medicaid choice is by far our biggest payer mix in the patients that we see. Next slide. So we started eConsults kind of in this organic, odd way. I wasn't there. We didn't have Epic like we do now, so it was this old, I don't even know if you want to call it EHR, but dermatology decided to do this. And back in 2015, again, it was because of access. And so the need for better access began this organic, how are we going to do eConsults? It lived outside the medical record. It was more of this like messaging back and forth. Went okay. I think it went fairly well in the beginning from what I hear, but it really wasn't until Epic went live in 2016, April of 2016, that we really started creating our eConsults live in Epic. And so it's through an in-basket workflow, but we didn't have a separate platform, and we still don't because it works so efficiently to have Epic, where we actually created an eConsult platform where providers will either choose referral, regular referral, or they can choose eConsult if that specialty allows eConsult. And they fill out basically a form online, submit all they need to do, and then it comes back. And they have 72 hours to do that, but everyone hits 24 hours or less. And so in 2018, we brought on 5 new specialties for eConsults, kind of an order-based workflow, like I was saying. They're actually putting it in like a referral or eConsult. The primary care physician or specialty, whomever is doing this, chooses what they want to put in. We gave typically a physician in a clinic, it's one that does this. So it's not like we have 10 people in residence doing eConsults. It's typically one provider doing this in every clinic with a backup when they're on vacation. We give a shadowing RVU for specialists, and we created an eConsult work group. So it's a place where new people that are interested, new clinics come, and where we review data and continue to have more and more data. And then 2019, we added 4 more specialties. In 2020, we've added a whole bunch more. And I'll talk about that in a minute. Next slide. So this is what we started with data. We started, the amount of eConsult orders, the amount of face-to-face visits that came from that, and then the percent of visits needing that face-to-face and specialty visits avoided, so number of specialty visits avoided, which was really helpful for us to see. This is all validated data that we have. This is because it lives in the EHR, it's fairly easy to gather, and we're able to actually, what's nice about it is if the specialist is reviewing this eConsult and they say, oh, I think this patient needs to be seen face-to-face, they actually can just promote it to a regular referral. They don't have to write, they do write back, but they don't write back and say, so sorry, now your patient needs a regular referral, and now the provider has to put in a regular referral. No, they just promote it, and then we go along with our regular scheduling like we would for a face-to-face. So that's really nice for most of these come from primary care, so it's nice for them. They don't have to do added work. Next slide. So in January 2019, Health Affairs released an article done by the Weitzman Institute, and they talked about patients who had an eConsult as an average savings of $82 of Medicaid. This is for Medicaid, $82 per patient per month, less than those that had to have a face-to-face. So we use this data. Next slide. We use this data. So I don't have the current data because it wasn't validated, so I didn't want to put it in there. So I used older data. So I have 18 months of data from 2018 and through Q2 of 2019. And you can see we had 2,878 eConsults requested. We avoided 2,481 of those, so only 86% of the consults avoided the actual specialty visit. And that's the whole reason we did eConsults. Access is probably the #1 driver of this. Now it's becoming for other reasons. But using that Health Affairs article, we related that, and we saved in that 18 months $2.4 million reduced cost of specialty care visits face-to-face. That's pretty big. Last week when I talked about the national, it was about, $100 for the patient savings, average of $100. But when you add up the cost of health care, of reduced face-to-face visits, that's big. That's saving payers, that's saving, obviously we talked about the patient savings, but it's pretty big. And that was back, back last year. So now we have a whole bunch more specialties, and so that cost savings continues to grow. Next slide. So our current clinics with eConsults, a lot of medicine clinics, but we have added some interesting ones, hepatitis C, anti-coag, podiatry, that's a huge one. Podiatry access is difficult, so that has been life-saving to do that. Pediatric asthma is our only one that we have for pediatrics. The rest are adult-driven. In 2020, now this is interesting, we added, breast and vascular surgery, urology, but I want to talk about the pulmonology thing because we don't make it at Denver Health. Everyone has to have eConsults. We let the clinics come to us and say, I think I'm ready. Some are holding out for payment. But the pulmonology, they said, we don't really want to do that. Then COVID hit. And, you know, most of those docs are running the ICUs in Denver Health, especially March and April, right? And they said, we got to do something. And so we put an emergency request to get pulmonology built for eConsults, and that helped them survive COVID, to be able to have an ambulatory outpatient clinic. Next slide. And so you can see the trend here. These are all the eConsults. But I just wanted to show, you know, the trend line. You can see down where March and April, where eConsults actually dropped a little bit for the other specialties. I think, you know, telehealth got in there, and telehealth took over a little bit of the eConsults, and people say, oh yeah, I forgot about eConsults. We have that too. So now we have telehealth, in-person, and eConsults, and you can see it going back up again now that people are back on track, and now they have, you know, all three options. Next slide. And so this is just, this is kind of the last year. The amount of eConsults is similar to what Matt talked about. Chris, you know, dermatology, endocrinology, neuro really uses theirs for headaches alone, and it's had great results. Next slide. And some of the successes and challenges, you know, doing a lot of what Chris and Matt said, but obviously it's patient-centered. Patients don't have to come in if they don't have to. Most of the patients we survey know about this, and they're really happy with the fact that they don't have to come in. Sometimes some do, and that's all right. And we let them if they're really insistent on having that face-to-face. It preserves specialty appointment access. I mean, like I said, that was our main driver. And enhanced learning for the PCPs, right? They're always, you know, every PCP is at a different level of education and years experience. Documentation of provider-to-provider exchange in the patient charts. We have that in the chart, so we don't have to, you know, get it from somewhere else. All that exchange is made within. Specialty productivity is captured. And some of the challenges we had is just like, you know, we did this for specialties for the shadowing RVU credits, but the PCPs sometimes are over here like, we put in a lot of work to this too. So we don't do that yet. We have outgoing and incoming eConsults across the community. So we're really looking, right before COVID, we were about to partner with Colorado Coalition for the Homeless. And, you know, we can do our outside partners that are not in Denver Health through Epic Care Link. So they do that anyway. That's how they submit referrals. That's how they get information back. So we create a same eConsult platform we have internally for external. And of course, the value-based payments, we're not quite there with payment. Talked about that other than Medicaid or Medicare. This is really a driver, and some of the line for some of the specialties to go forward is that they're kind of waiting for a little bit more of the payment till they really make it a solid platform for them, such as cardiology. Next slide. I think I'm ready for questions. I put in a video link, so if you get the slides and you want to watch a video, it's a video we did last year, last August for CMS. I went to Baltimore and presented this, and it's just a nice little 5-minute video about Denver Health and eConsults. So I think I'm ready for questions if I have any time left.
Perfect. Thank you, Beth. I think it's been used a few times throughout all of the presentations. I just wanted to clarify for some beginner eConsult people, pointing at myself, what does RVU stand for?
It's like the volume of visits that you have. Okay. And so, so we use shadowing RVU, so they wouldn't get like 1 visit equals 1 eConsult. It's a lower percentage because it doesn't take as much time as a visit. Typically, right. It's a lot faster.
Right. Thank you.
Sorry.
No, you're good. We just try to define those.
I forget acronyms and all that. And
on that same note, you listed OBHS as a new specialty. What does that stand for?
Behavioral health.
Oh, okay. Okay, great. Thank you.
So we're starting to use, behavioral health.
That's great. Yeah, I'll just get into another question that came in. What data is available for patient satisfaction and clinical outcomes?
We're doing it, right now we're doing it survey data, where we're taking surveys, emailing patients that have had an eConsult, and doing a patient satisfaction survey that way. We have a lot more data similar to university that we're breaking down by race and payer, and really trying to find the pockets that are utilizing eConsults most, if it even makes a difference. When the providers are doing it, they're not looking at, they're just looking at all patients the same, but we're really trying to break out the data more so to see what impact it's having, if it's having an impact on special populations.
Great, thank you.
Yes, it looks like we have time for just one more question. But in your second to last slide that you mentioned challenges, a question came in is, what might payment for eConsult look like in terms of a value-based model?
Well, if you're looking at value-based, you're looking at cost savings overall and outcomes, right? So you're looking at data like, did you not only avoid the face-to-face visit and save healthcare dollars, but did you avoid the ER visit? Did you avoid a readmission? That kind of thing that goes into the outcome. Did the patient have the same or better outcome from an eConsult that they would have had, in a face-to-face? And the
Awesome,
time spent, obviously, with the patient.
Thank you so much, Beth.
You're welcome.
Up next, and definitely last but not least, we would be remiss if we didn't include patient perspective on this important topic. So Lori and Katie will be providing more personal experience from eConsults. Just Lori and Katie, you both will have 5 minutes, and we'll have a little bit of time for questions. Nothing too personal, audience, for the questions. We want to respect some privacy. Thank you. Katie, or Lori, would you like to go first?
Sure. Good afternoon, everyone. Thank you so much for including me in this call. I appreciate that. I've been asked to share some of my impressions and experiences with telehealth. And I will say that by and large, my experiences have been really, really positive. I personally am confined to a wheelchair, and so the telehealth appointments for me have been tremendously convenient. Normally, I'm relegated to utilizing NEMT, non-emergent medical transportation, and just that alone is tremendously time-consuming. And in order to typically make and go through a medical appointment, I would have to set aside at least half a day, whereas now with telehealth, I can have my appointment and be done with it and get on with my day without any problems. Initially, admittedly, there were a couple of hiccups involved. The doctor's the doctor's office had some difficulties with the technical aspects of the call. And I did sit waiting for a little while for the doctor to come in when I was aware of a tapping sound, and eventually realized that it was the doctor knocking on the door because they had forgotten that it was a telehealth appointment and they were waiting for me to tell them to come in. But aside from that, I find that these appointments are a much more relaxed atmosphere. I have time to go over any issues that I have that I wanted to speak with the doctor about. I don't feel rushed as I do normally in a doctor's office, especially with, not knowing if the doctor's running on schedule or not. And if they're at all behind schedule, then that kind of throws me into a panic because I don't know if I'm going to be out in time to catch my ride and get home as it was scheduled. I find that as long as I'm dealing with a doctor with whom I'm familiar, the appointments go very smoothly, and overall, I have nothing negative to say about telehealth appointments. I think that they are a wonderful way to handle healthcare, and wish that it had come along much sooner, and I hope that it continues for a long time to come. I think that's pretty much what I had to say, and I will turn this over to Katie at this point.
Thank you, Lori.
Thanks, Lori.
Sure.
And thanks everybody for including me and Lori. We worked together on a couple of boards at Health Access, Colorado First. I am thrilled as well with eConsults. I have just a couple of notes I wanted to share. Particularly my behavioral health appointments, which I'm required to have because of, my disabilities, but it's more comfortable at home. I feel more at ease. And I find that some of the difficulties that I normally have in an appointment, i.e. anxiety, are almost, disappeared for good. I feel very comfortable going into the meeting. I'm also able to plan for that appointment, which I really haven't done well in the past. Specifically, I can talk about diet, sleep patterns, because I'm making notes of that between appointments. And so I have found that to be very helpful, and I'm getting more significant advice and direction from my therapist. Let's see. Okay, as far as in person, I've had several appointments since COVID. And I'll say that dentists was interesting because what I'm doing is trying to have a treatment plan put together that would be approved by a disability trust that I have. I cannot have any work done if I expect it to be paid for. So it's really important for me to get treatment plans in advance, which is a lot of work for a doctor, particularly a specialty doctor. But Denver Health's dentistry has done a great job. And then we're able to consult, telehealth with all of the information that they've shared with me. I had surgery, carpal tunnel surgery in June. I never saw the surgeon. We talked once before. Essentially I told her, you've done this 100 times. I don't need to see you. I completely trust you. The difficulty on that one, though, has been the occupational therapy. I thought I could do it on my own at home with some of the tools they gave me, and I'm clearly not doing it enough or not well enough, so I have scheduled an in-person therapy appointment. Audiology, I did have to go in because I needed hearing tests, but other than that, I've had a really great experience with telehealth, particularly with my behavioral health appointments. I have 3 different doctors, including an addiction counselor at behavioral health at Denver Health. So I am very grateful and I'm very happy with the way it goes. Thank you.
Thank you both so much. Thank you for opening up and sharing your experiences. It definitely sounds like eConsults and telehealth experiences increase access for you all and for other patients, all patients. So we really appreciate you lending your personal perspective.
This is Katie. Can I ask a question? How do you define the difference between telehealth and eConsult?
Yep. So telehealth is when it's patient to provider, like patient to doctor, like on video. eConsult is when like your main primary care doctor will talk without you present, like email version kind of with your specialist to kind of create a care plan.
Okay, I do want to add that my primary care did share some skin issues, and he was able to just send them directly to dermatology, and then dermatology simply prescribed some cream. So it saved me time and frustration. I don't drive, so like Lori, I have to depend on public transportation, and all that anxiety goes away, and it saves so much time. That was one example. I believe that would be an eConsult that went very well.
It definitely sounds like it, and it sounds like it benefited you hugely. So thank you so much for sharing that. Are there any questions for Katie,
Yeah, a question did come in, and it sounds like it can kind of be open to maybe any of the speakers or Katie or Lori. Can patients request an eConsult, or are they always initiated by the PCP? It's a really good question.
This is Katie. I mean, for me, Dr. Long at Denver Health said, this is how I think we can go forward, saving you a lot of time. So now thinking back, I'm guessing that was the opportunity for an eConsult. I didn't even know that's what he knows it by.
Yeah, and at the University of Colorado, we're creating marketing flyers for patient education and other sort of patient education, to where patients are educated on what eConsults are and the value that they bring. And through that process, the patient could certainly ask for a eConsult. If a primary care provider was going to recommend the referral, they could talk through that. But that's part of the education to patients and making sure patients are aware of all the different types of care they can receive.
Mm-hmm. This is Katie again. You know, I chair the Patient Family Advisory Council, and we get a lot of questions like this because we're looking at parents and grandparents taking time out to go to appointments. And so a marketing effort has really been on my chart. And we're talking now about how to include in my chart a message, a marketing message on the importance of telehealth and eConsult.
So another question that came in, and this could kind of go about with like some of the stories that you've heard on the patient advisory, but like with your experiences, what has been the time frame in which you've had to wait in order to speak to a provider?
This is Lori. It's been my experience that turnaround time has been much more rapid, and the same goes for ease of obtaining an appointment. It's been much quicker with the advent of telehealth. I rarely have to wait more than a day or two, and I also don't have to factor in a lead-in time for scheduling transportation. So it's been a very smooth, rapid experience.
This is Katie. One of the, my appointments come up very quickly. I want to say after seeing the PCP, within 48 hours, a specialty clinic reaches out to me. I've been very impressed. And something else I wanted to add on the telehealth is that, particularly from behavioral health, some of our elderly and I would say mentally challenged, it's better to have a family member on the call with them so that we fully understand as a family or as a caregiver what the issues are. Sometimes that's very difficult for a patient to communicate to family.
That's a great point. Well, thank you all. In the interest of time, I just wanted to do a quick wrap up. Thank you to Chris, Matt, Beth, Katie, and Lori. Sounds like there are tons of marketing and communication efforts, data pulling. Please do share as those are developed. Please share those with Mile High Health Alliance and Aurora Health Alliance. We want to help elevate the work that you're doing in this important area of increasing access to the vulnerable and underserved. So thank you so much.